Hi there. I'm Howie Foreman. I'm a professor in the School of Management and the medical school, and I have the distinct privilege and honor of introducing today's event. Both of our panelists require no real introduction, and I'll try to keep this brief for that reason. But I do just want to thank a number of people who have made this possible, because the series of events that we've had, including this one, have really been nothing short of spectacular in terms of the collaboration of so many people. So I want to thank Marie Crane in the Dean's office and Cheryl Holbrook and others in the Dean's office for hosting this event, to Claire Masters from the School of Public Health, who's my colleague, for helping coordinate really the entirety of the two-day event, to Dr. Murthy's staff, including Mary, Trey, Vanessa, Tyler, Anna, Tag, Jamie, and Jane. And just a side note there, I've worked with Jamie for 2 years and never met her in person until today, so it's great to have her. And also thanks to the folks from Yale Security who've been helping us all day and tomorrow. And finally to Josh Sang Tham and Allison Lyons from the MBA class of 2023 for conceiving and coordinating this specific event so it enrich all of our students' experiences here at Yale. Dean Kerwin Kofi Charles is the Indra Nooyi Dean and Frederick Wolf Professor of Economics, Policy, and Management at Yale School of Management, and I am sincerely and deeply appreciative of his leadership in all ways, but particularly in sponsoring the Dean's Lecture Series, and for his willingness to participate in this event with our alum. Dr. Vivek Murthy is our nation's 21st Surgeon General, having been confirmed by the Senate in March 2021. He was also our nation's 19th Surgeon General, serving under Presidents Obama and Trump in that role. He's also Vice Admiral of the U.S. Public Health Service Corps, overseeing 6,000 dedicated public health officers, including one who is among us in the audience today, who worked with him in his first term and who's in our EMBA program right now, Naslim. His focus has been on combating the growing proliferation of health misinformation, the ongoing youth mental health crisis, well-being and burnout among health workers, and social isolation and loneliness, a topic that he addressed in his best-selling book, Together. I first came to know Dr. Murthy 23 years ago when we met to talk about his interest in adding a management degree to his then medical training and medical school experience. His passion for improving the health of individuals and populations has never wavered, as he has demonstrated through his entrepreneurship, his public service, his clinical hospitalist and internal medicine care, and his persistent advocacy for the health and well-being of every person, regardless of their station in life. I'm truly proud to call him a former student, an alum of the School of Management, an alum of the School of Medicine, a friend, and most of all, a mensch. Please join me in welcoming our Surgeon General and our Dean.
Dr. Murthy, thank you so much for joining us. Can everyone hear me? Are we properly mic'd? Let me ask you this. How does it feel to be home?
It feels amazing. I'm so glad to be back at Yale. I've been regaling my team members with stories of my time here at Yale. I think they're sick of hearing about my experiences here at Yale, but I talk about Yale often because this place meant so much to me. And my time here really transformed who I was, how I thought about what I wanted to do in the world. I will say I came here, I was telling somebody the other day, because my kids are 4 and 6, and they just started school in Washington, D.C., the school year just began. And my daughter's final words before she went to sleep the night before the first day of school were, I don't want to go to school, right? And I was saying to someone, I can't really blame her, because I never really liked going to school. In elementary school, really, it was like in college, I didn't really like it. I first started liking going to school when I came to Yale. And that's when I found that getting up every morning was a source of joy, it was excitement, and in no small measure it was because of the people that I was with and the community that was built here. I will say that this building is a lot nicer than the one that I went to business school.
We like it. We like it.
I took, in fact, my team members by the old building, showed them where it used to be the Hall of Mirrors and the courtyard outside, and they came here and saw that, yes, the school has been upgraded. But regardless, it was a powerful experience for me. I'll lastly just share this, that when I came to business school here, and I would not have been a student here if it had not been for Howie Foreman, who you just heard from a moment ago. Howie was and continues to be my most important mentor in life, and has just been such an extraordinary guide. But he's the one who sort of introduced me to the idea of doing a degree here. And one of the it changed a lot for me, but there's one thing I'll share with you that it did change, is how I saw change, right? Because I came from a world in medicine where change was understandably sometimes looked at with suspicion, right? You don't want your surgeon just experimenting with new techniques on the fly in the OR, when you're under the knife. You want that surgeon to be using well thought out, tested, rigorously studied techniques. But here I came to see that change was an opportunity to make things better, to ask fundamental questions, to revisit our own assumptions. And when I went back to medicine, I felt like I was looking at things in a new light. And that is one of those intangible impacts of an education here at the Yale School of Management, which you can't necessarily put into a simple box or say, yes, I learned incredible skills in finance, or I learned how to market a product better than anyone else could because of the marketing class that I took with Ravi Dar. Like it's more than that. It's about a shift in perception in how you look at the world. And so I will always be grateful to the Yale School of Management, and that's why it's so nice for me to have the chance to be back here with all of you.
Fantastic. We are, of course, delighted that you're here. As I listened to you talk just now, your description of how it gives you an eloquent description of why you came. I was put in mind of this question: why did you take on the Surgeon Generalship a second time? What made you do that?
It was the money. No, just kidding. No, government salaries are probably a lot less than what all of you will be paid when you graduate. It wasn't that. It was. So the reason I took it on the second time was, first of all, it was in the middle of this terrible pandemic, right, that we had been and have been going through. And I had spent, probably from March 2020 onward, I had been working closely with then Vice President, or then former Vice President Biden, because I had been briefing him with another colleague every day on COVID-19 from March onward. And it was an intense experience. It was, we were all learning, as this was going through. And he was always so thoughtful and nuanced in his questions, and so curious, about subject matters that we would often spend like an hour and a half in these briefings each day. And so it was a very intense experience. Despite that, I never thought I wasn't planning to come back to government. But then I remember toward the end, as elections started getting closer, I remember him saying, he was saying if he was so blessed to have the opportunity to serve the country once again, he wanted us to come back and help, to address the pandemic in particular. And then he and I had a lot of conversations about the other effects of the pandemic, the impact on mental health, on substance use disorders across the board. And I remember him saying, hey, when he asked me about this role, saying, we really need to do something together about those broader crises also. So when that ask finally came to come back and serve, it was a big decision, but it wasn't a hard decision, because I remembered in part the lesson that my parents had taught me when I was growing up, not so much by what they said, but what they did, which is that when people around you are struggling, whether it's an individual or whether it's your community, it's all of our jobs to step up and do whatever we can in that moment to help. It might be something small, it might be something big. In that moment, I felt I was being given an opportunity to serve and help address that crisis at a larger level, and it felt like the right thing to do. It felt consistent with the values that my parents had instilled in me. My wife, it also did not escape, sort of our thinking that for my wife and me, that our kids would read about this crisis in the history books one day. And they would probably, when they read about it, ask us, Mama, Papa, you were there in the middle of this crisis. What did you do to help when people were hurting? How did you step up? And we didn't want to say, well, we just thought we would kick back and hang out in Miami where we were at the time and just dial it in. We wanted to be able to tell them, frankly, the same lesson that my parents had taught us, which is that When our community was in need, we stepped up to do everything we could, everything that was in our capacity to support other folks. So that's why I came back, and again, like I said, it was a big decision, but it was not a hard decision to make.
I see. An interesting thing about the important office you hold is that you are tasked not only with addressing problems that emerge around you, that the whole world knows about, and it's a pandemic, isn't it? But Surgeons General, historically, have brought to our national attention things that were similar, whether it's gun violence, on which you've spoken, whether it's vaping and e-cigarettes, whether it's academics. You, recently, have emphasized to us the importance of the national problem of social isolation and loneliness. What is that? Why are those two things different? Loneliness versus social isolation. Why are they?
Good question. Let me actually just ask folks here, how many of you know somebody in your life, maybe it's you, maybe it's somebody else, how many know somebody who's struggled with loneliness in the last few years? What you just saw in terms of the number of people who raised their hands, almost the vast, vast majority of people in this room, this is representative of what's happening all across the country. So loneliness is a feeling, it's a subjective feeling that the connections we need in our life are greater than the connections we actually have. And in that gap, we experience loneliness. Social isolation is actually an objective term that describes the number of people we have around us. But what ultimately matters to most of us is how we feel. And the truth is that you can be surrounded by lots of people and feel very lonely. It's very common on college campuses and graduate school campuses for people to be surrounded by thousands of other people, but to feel profoundly isolated and alone. And in fact, if you look at the data, the recent surveys from like 2018 and 2020 were done by the insurance company Cigna, using good validated scales, they show us that the percentage of people across the age groups who struggle with loneliness is around 60%, 60, right? To put it in another context, there are more adults struggling with loneliness than adults who have diabetes in the country. But those numbers are particularly high among young people. They approach closer to 75%, right? And like, why does this matter? Well, it matters because loneliness is more than just a bad feeling. Right? It has real consequences to our mental and physical health. So people who struggle with loneliness over time are at an increased risk for not only depression and anxiety, but also for cardiovascular disease, for dementia, for premature death, for sleep disturbances, for a whole host of other health conditions that we worry about, conditions that those of you who have worked in hospitals or clinics, have seen. And so it is both common and consequential. And that was one of the reasons why I wanted to raise the alarm that this is a public health issue, and one that we're actually not talking about because there's a lot of shame that people associate with loneliness. Because we live in a very extroverted society. And in this society, like especially you go back to freshman year of college, your first year of college, and think about like how popular it was if you were the person staying in on a Friday night to read a book, right? That person was sort of seen as a loser, as a recluse, pick the term, like it was not often favorable. But in that environment, to say you're lonely almost feels like saying you're not likable, or even worse, that you're not lovable. And I know this because that's how I felt as a child when I struggled with loneliness over the years. That sinking feeling in my stomach that I felt when my mother dropped me off at school each morning was not fear because I was worried about tests or scared about teachers. It was just fear about being alone again, about walking into the lunchroom and not knowing if there would be somebody to sit next to, about being on the playground and being the last one to be picked, not because of my athletic skill. I was actually fairly athletic, but because I wasn't connecting with other kids. And so I didn't at that time know that there were so many other kids in school who were experiencing the same thing. Years later, when we all have had conversations, people would say, oh, I was feeling exactly the same way. But we didn't know it at the time. So that's why I think we have an issue that both needs to be brought out from behind the curtain and also one that has to be addressed. And I know we'll talk about this a little bit more today, but to me, one of the most profoundly encouraging things about addressing issues like loneliness is both how impactful it can be, not only to our health, but because Our connections with each other truly are the foundation on which we build successful families, communities, businesses, and overall social enterprises, but also because it's something we can all participate in. You don't need to have a medical degree or a nursing degree or to be a psychologist or a public health expert to help address loneliness. You simply have to be someone who's willing to perhaps talk about your own experiences, or somebody who's willing to reach out to someone else with an open ear and an open heart to see how they are, to invite them in to conversation. These simple steps can make a big difference in how connected we feel and how we build connection in the community around us.
I'm very curious, Doctor, about whether there are ways in which both our leisure, how we have fun, and our work have come to be organized that contribute to the phenomenon you're describing. I have in mind here, I remember years ago there was a view that bowling rates had declined dramatically. Bowling Alone was the name of the book that documented this concern. And now, people, I look at my nephews and them, they do that's not Game Boy, they play video games with other people, not even close to them, like they're doing things. We spent several years Zooming. It's a word now. We're not in the office engaging with each other. As you look around how we play and how we work, do you think there are shifts in how we are organized that contribute to the rise in loneliness that you've been describing?
Yes, I think that's a very good question. And I think especially for those of you who may be in positions, either now or in the years ahead, to shape some of those environments, to shape and design workplaces in particular, I think there are really opportunities to address the loneliness crisis. Because yes, the simple answer to your question, Dean, is that yes, the structures in our neighborhoods, in our schools, and in our workplaces do impact our connection or our isolation, right? And we have to think also about and that not all connection is the same, right? I may have X number of followers on Twitter. Does that mean I'm deeply connected to them? Connections that are the most meaningful at staving off loneliness are those where we feel like we are seen and understood by another person, where we feel we can be ourselves, truly ourselves, with someone else. Those are the relationships that help us feel like we belong, that we're not alone. The connections which are just affiliation, where we don't have moments of vulnerability, of sharing with one another, those are less powerful, right? In fact, those can be illusory. They can give us the sense that, hey, we've got lots of friends or connections, but we actually aren't deriving what we need from those connections, which is opportunities to be real, to be ourselves. So how can workplaces in particular help? Well, there's actually really interesting data from actually my old SOM professor, Sigal Barsaid, who taught organizational behavior when I was here. She since moved to Wharton and then very sadly passed away a few months ago after a long struggle with cancer. But Professor Barsaid has done some wonderful research over the years, which has shown that people who struggle with loneliness in the workplace, it has a real impact on how they function in the workplace. And this research from her and others has shown that productivity suffers, creativity suffers, retention suffers, and it's not just isolated to the individual who feels lonely, but it has an impact on the people around them. So even if you are purely thinking about how to make a workplace functional and to improve the retention and productivity of your workforce, ensuring that you are doing things to actually create stronger connections in the workplace matters. And one more thing I'll say on this is how to do that, right? Because the traditional way to do that was to say, hey, let's have happy hours, let's have company picnics,
Closing bell.
Oh, what is it?
That's a thing we do.
Oh.
They know.
Yeah, and it's not that those things are bad or they're not helpful, but they need context and they have to be complemented by opportunities through which people can get to know each other. Because if I took, let's say none of you knew each other, and we just suddenly put you all in a room, put on some music, provided some snacks and drinks, and said, go forth and mingle, right? Mingle, by the way, was the name of the dating app that a friend and I were thinking about.
Really?
Some years
I like
ago.
it.
That's a whole
I like
separate
it.
story.
It's a good name.
We can get into that later.
I like it.
But some of you would form nice connections and have great conversations. But others of you may sort of linger in the shadows, not be sure quite how to start a conversation. You might have sort of conversations that were okay, but a small talk. You may not necessarily have gotten to the sort of truly know someone else or share in and of yourself. So it turns out that a little bit of structure can actually go a long way toward making gatherings effective at forming connections. I'll give you an example from our office, something that we do. So both when I was Surgeon General last time, and Nesleen, who is my Director of Science and Policy here, probably remember this, and also this time around, which my current staff knows, we have an all staff meeting, a weekly meeting, where everyone comes together. Not unusual, most organizations do that. But we spend a few minutes in that meeting where we have a lightly structured opportunity for people to help get to know each other a little bit better. The first time around, what we did was when I was actually the first time, is we had 5 minutes where we asked somebody, one person would bring in pictures, and we would tell them, bring whatever pictures you want, anything you want, as long as it's not related to your current job. And then just tell us about those pictures. Seems easy enough, right? People would bring in all kinds of interesting things. One person in our office who, she was always like very studious, very sort of focused on her work. She wrote the longest memos, most detailed, et cetera. But I remember she brought in pictures of her running and training for long distance runs. It turned out she was actually an Olympic level long distance runner. She was a warrior when it came to athletics. We had no idea. But it helped us see a different part of her that we hadn't recognized. It was just 5 minutes. And now we do something called our Humans of OSG exercise, OSG standing for Office of the Surgeon General. But we'll pick 2 people each week, one to interview and the other to be interviewed. And it'll just be about 10, 15 minutes. But they'll ask each other, one of them will ask the other questions about their life. Tell us a little bit about where'd you grow up? How'd you make it? How'd you think about this decision that you made? Who's meant the most to you? What kind of music do you really enjoy? What inspires you? What makes you scared? What worries you? What gives you hope when you think about the future? The questions may be varied, but we leave those 10, 15 minutes coming to understand each other a little more deeply. And you imagine if you then do what I talked about here, put everybody together in a room with some snacks and some music, it's a lot, you have much more fodder, right? Through which to actually have conversation, because you've heard something interesting about somebody and something personal. It's not just something interesting like, hey, I heard you have every color of the rainbow in your closet in terms of sweaters. It's not like that, but more like, I understand something about you as a person. I understand something that has helped shape you, something that was pivotal to your experience. So we can design workplaces that with just a little bit of time and a little bit of structure can create these opportunities for us to know one another. And we can do that in school settings too, in colleges and universities. And if you ask me, that would make orientation week a lot better, right? For a lot of people who may not as easily, find that they form connections in large groups with lots of music, but who may find those smaller opportunities, this little bit of structure will help set them up to form deeper connections, in those larger gatherings.
So 60%, you said. That's a big number. That sounds like a massive systemic concern. You didn't say 6%. So I presume you want to make progress on that. You would like the nation to make progress on that. In thinking about what you said, and I took some notes here, you emphasized that loneliness is a subjective concern. It's something that I feel, you see? How I feel, how she feels, how you feel. How do you make progress at scale, yes, on a systemic concern that's fundamentally subjective? You see? What does one do with that? How do you tackle that?
Yeah, it's a very good question. I think historically we've tended to dismiss subjective, measures or subjective issues as being kind of under somebody's individual control, all in their head, something that they should be able to manage on their own. But I think more and more, as we've come to look at public health in particular, we've realized that those subjective measures, they tell us a lot and they're often determinative. So for example, when you look at data that ask people for their subjective assessment of their own health, and specifically their own mental health, that actually is very powerful in predicting often how they do in terms of their health down the line. There's something about people's perception that often tells us something deeper about what's happening in their life that they themselves may not be able to put into words. So I think about the perception as the final common pathway, if you will. There are many things that contribute to that. Somebody may feel lonely because they are in an environment where they are not seeing anybody. They may feel lonely because they're struggling with serious self-esteem issues that come from trauma they've experienced before. The reasons may vary, but the common pathway matters to us. And the good news is we can measure that too through validated scales. Once we have that, I think if you want to address any systemic issue, like one of the things you have to do is, number one, you have to be clear about what the stakes are, right? People want to know, does this matter? And if so, why does it matter? That was one of the reasons I was sharing, that the health impact on product, on the workplace, the impact on our children's performance in school, these all suffer when kids are struggling and people are struggling with loneliness. So you've got to make the stakes clear. The second thing you have to do is you have to bring the right stakeholders to the table. And the third thing is you have to provide a clear pathway for action, right? People may care about an issue, but they may not know how to go about addressing it, right? But as a leader, and sometimes in this case maybe as government, one of the roles you can play is to actually bring people together around a common vision and strategy for how to address an important crisis, right? But then you've got to do something else, which often gets missed, is if you truly want to be effective, not just in that moment, but if you want a sustained response, you have to bring the public with you, right? And this is the part that's hard to do. So it doesn't just get missed because no one knows it's important. It's because it's actually quite hard to do. But here's what happens if the public doesn't come with you. So if we were to, for example, launch a loneliness initiative, but very few people in the public really understood why loneliness was a problem, why it mattered, how common it was, we may get a little bit of momentum, but if you need sustained funding, if you need sustained congressional support, the public's opinion matters there, and people need to know the public cares about this. Now, I'm using a governmental example, but this applies to other settings as well, right? If you're trying to implement a change, like in an organization, right, and you decide, let's say you're the CEO, and you decide along with the board and your senior management that there are a series of changes you're going to make, but you don't have the buy-in and the engagement of people throughout the organization, it's hard to sustain those kind of initiatives. It's hard to get the participation you need, and then ultimately down the line, it falls into a long list of well-intended initiatives that tend not to have, a whole lot of impact. And somebody on the board will say, why are we investing in this, year after year? What's the real return on investment here? And it's really hard to show one. So the bottom line is you got to bring people along. So that's where I think what we're trying to do here with loneliness as well, is we're recognizing this is one of those issues that so many, and I'll tell you, it is not easy, not hard to actually get public interest in this issue. Because of those numbers I mentioned, so many people are struggling with this, or they're seeing it in their own lives. They're not quite sure what to do about it. They're often thinking they're the only one. So many of the conversations I've had with people around the country on this issue have been not conversations where somebody's raising their hand and saying, hey, I'm John, I'm struggling with loneliness. They've been whispered conversations afterward in the line after a talk where people will say, hey, I just want you to know I'm really struggling with that too. I remember in DC a few years ago being at an event where a woman came up to me and she said, I just want you to know this topic of loneliness really means a lot to me because my husband is desperately struggling with loneliness and we just don't know how to help him. And he can't even find words to express it. And she stepped aside just 6 inches to the left, and I saw that he was actually standing right behind her. Wow. And he had tears streaming down his face because that's how deeply it had impacted him, but he didn't feel he could talk about it. And just a word on men for a moment. Not just in American society, but in societies across the world, we often tell men that masculinity is about not needing other people. It's about not showing your emotions, right? It's about being an island unto yourself. That is just contrary to the thousands of years of evolution that human beings have gone through, right? We have evolved to be better together. The person who said, you know what, I'm going to go it on my own, thousands of years ago when we were hunters and gatherers, you know what happened to that person?
Not here.
They got eaten, right? Or they starved from an insufficient food supply, or something bad happened to them, right? But it was the people who built trust, who worked together, who realized that relationships help us go farther and last for longer. Those are the people who survived. And that is actually still true today. And it's so interesting because we've evolved to be that way. Thousands of years ago, if you were separated from your tribe, that triggered a stress response, right? Because it meant that you were more vulnerable, right? So, and with that stress response came a heightened sense of awareness, if you will, almost like a hyperactive sense of awareness. That hyperactive state of awareness, what we call hypervigilance, right? That was understandable back then, right? Because if there was even a 1% chance that the twig that cracked behind you was a predator, you wanted to interpret it as a threat, right? But think about now. right? Even though our circumstances have changed, our nervous systems are actually very similar to what they were thousands of years ago, right? So when we start to feel lonely, that same primitive response crops up. And loneliness is no different than hunger or thirst in that it's a sign that our body is sending us that something we need for survival is missing, right? If we respond to it and reach out and find connection, it may go away. But in that state of hypervigilance, especially with chronic loneliness, it can lead us to do things that are counterintuitive, right? It can lead us to be suspicious of other people. And how many times have you met somebody and thought, gosh, that person's aloof. They don't seem to want to interact with other people. What's wrong with them? I'll tell you that a lot of times people you perceive as aloof are actually lonely, right? And it's that hypervigilance response, it's that suspicion, et cetera, that may make them push people away, ironically, exactly at the time that they need to pull people close. Okay. Is one of the consequences of that, which is the more you do that, the lonelier you get, the more it chips away at your sense of self-esteem. The more you start to believe that you're lonely because you're not likable. And you start on this downward spiral. The things that can break that spiral are what matter. And sometimes it's somebody reaching out and bringing you into their life who overlooks that aloofness, who might recognize, there's probably more going on than I understand here. That can help break this cycle, and you can do that for other people as well. But the other thing that helps break this cycle is actually service. It turns out when we serve other people, whether that's going to volunteer at an organization down the street, or whether it's helping somebody in our class or helping somebody in our community who's struggling, those small acts of service do two things. Number one, they allow us to connect with somebody deeply on something that matters to them in a moment when it matters, but they also reaffirm to us that we have value to bring to the world, and they help rebuild that esteem which gets shredded when we are lonely. So if we actually think about how to address this, I think the reason this resonates so deeply with people is it's part of their lived experience. But what we need to do is help people and society more broadly understand what the pathway is out of that. That's why our office is building a broader initiative on how to rebuild connection and community in America, recognizing it's something we need to do not just for our health, not only for the well-being of our workplaces and our schools, but frankly, for the health of society and the functioning of our democracy. We cannot come together and solve difficult problems if we aren't invested in one another's well-being. And that investment can't just be theoretical. It has to be borne out and supported and fueled by relationships we actually have in our life. Like if I know Kerwin and let's say he has kids and I don't, right? But we get to know each other well and I care about his kids. I might go attend a school board meeting where something important is happening because I care about his children too, even though I don't have kids. If Kerwin comes to know that I have a 90-year-old grandmother who's at home and we are struggling with how to care for her with caregiver burnout, that my mother is really at the end of her rope here, and we don't know what the solution is, Kerwin might be more likely to go and advocate on home care issues because I'm part of his circle and he knows it matters to me. So the way we expand our circle of concern, the way we come to advocate for issues and on issues, even if they don't directly affect us, is by building relationships and coming to know people, and especially expanding those circles outside of our traditional communities. That's the way that we address the deep inequities and deep challenges that we have, whether it's economic inequities, whether it's poverty, whether it's the pandemics we're dealing with now and may need to prepare for in the future. We can only do this if we are together, and we can only be together if we are building real relationships with people around us. So that's why, to me, this is such a fundamental issue. This is not some side issue, some, maybe if we get to it, that'll be great kind of issue. This is we're talking fundamentally about the foundation of society. It's built on human connection. That social fabric is eroding. This is our time to stitch it back together, and we've got to do so intentionally.
Beautifully expressed. I want to not monopolize all the time and turn some questions over to the students. But before we do, while we get the microphones and so on organized, and pass to one of these future leaders of business and society, I want to focus on the leaders part of what I just said. So I'm a kind of leader, right? And I'll confess that when one is dean, the role carries with it a certain loneliness. I'm worried about staff size, or the students coming, or, you know, or what happened with that faculty member, you see? And as dean, I can't, there's no, there's a certain vulnerability that is necessary to share with people one's anxieties, concerns, doubts, you see? But the space for revealing vulnerability shrinks as one moves up the leadership ladder, as they will, you see? And so I hope someone asks about how, when they move into leadership positions, they can help address leadership for those whom they prefer. But you have advice for me and for them, yeah? Do you see what I mean?
I mean,
Yeah.
first of all, what an insightful question. And I just want to point out something the dean just did, which is that was a moment of vulnerability as well, right? And strong leaders are people who are willing to be vulnerable, to talk about something that they may be struggling with too, right? And so to me, like that just highlights, you know, what a wonderful dean you have, but also that's a quality that I think is important. No, seriously, it's a quality that's really important in leaders, because sometimes like there's that old model of a leader who never sweats it, never doubts anything, is always certain about what to do, always has the answer. I don't know who that model describes, but it's not like any of the real leaders or CEOs that I've met or people who have like led major enterprises. They all have doubts, they all have fears, they all have worries. But your point is an important one, which is if we let ourselves stew in that worry alone, it can be corrosive, it can be exhausting, it can actually drive burnout. So we all need some spaces where we can talk to folks openly about what we're going through. Those people may not be in our workplace, but I'll tell you something. Can I just tell you something I did in my own life when I was struggling? So when I was when my time as Surgeon General the first time ended, right? It ended very abruptly. I didn't know it was going to end when it ended. It was all very, very sudden. And I had put like all of my time, effort, energy, heart, everything like into the job, right? To a fault, I would say, because I had neglected a lot of the other relationships in my life outside of work at that time. And so when I came out, I actually felt profoundly alone at the time, right? I was like, okay, now I don't have that community I had anymore. And I also just felt this weird sort of sense of shame. I felt this weird sense of just like uncertainty. All of this like weird, you know, your feelings aren't always rational. So all of these things are swirling in my head right now. And I remember having lunch with a friend in Boston, and I was like sharing with her about what I was dealing with. And she says to me, Vivek, she's like, you know what your problem is? She said, your problem is not that you don't have friends. It's not that you don't have people to talk to. She said, your problem is you're not experiencing friendship. And it was such a light bulb moment for me. Which, see, here's what she meant. She meant that a lot of us have relationships in our life that have gone dormant, right? Maybe it's the old friend from high school. Maybe it's a college buddy. Maybe it's somebody from a previous job. And either because of time or distance, or we think our lives have just changed, we don't really reach out to them as much. We don't talk to them. We're like, it'd be too hard to explain everything, too hard to understand. But she got me thinking, gosh, she's right. I actually do have relationships in my life, but they're latent. They're not active. So I need to think not necessarily about how to build friendships, but how to reconnect with my friends. It was a simple but important shift for me. So one of the things that I did is I decided to build something in my life called a moai. Has anybody heard of this concept? It's a Japanese concept. It comes from Okinawa. So the concept of a moai. So in Okinawa, going back many, many years, there was a tradition of forming these groups called moais, where they would bring young kids together, and let's say 6 or 7 children, and they would say, okay, all of you, you're each other's people going forward. You're supposed to look out for each other. You're supposed to take care of each other. It's your job. And that was your moai, right? And so I was at this retreat with a bunch of folks as part of a fellowship I was part of. And I saw these 2 friends Sunny and Dave, who I love dearly, were great friends, but we lived in different cities. We didn't see each other very often. And whenever we saw each other, it was like always like, hey, gosh, we should get together more often. I wish we saw each other more, but then we wouldn't see each other more, get together more often. Anyone have that experience with friends? Yeah. You know what I'm talking about. So, as we were walking around this lake there, I asked them, I said, what if we built a moai together? What if we made a commitment, just an explicit commitment to each other, that we're actually going to talk video conference once a month for an hour? And the other commitment we're going to make is that whenever something comes up in our life that's worrying us, that's making us scared, that we're uncertain about, or that gives us joy, we'll text each other. Even if it's just like a one-line text, just to let each other know. And the last commitment we're going to make to each other is that when we talk once a month, we're going to be real with each other. We're going to talk about the stuff that we're really worried about, and the stuff that friends don't typically talk about: our health, our finances, our relationships, our fears more broadly. And so we started doing that. And I will tell you that simple moai, that simple commitment, that changed my life. And I needed that, during that time. But I've also kept that moai during this time as Surgeon General as well. And it has made me a better leader because it has given me the ability to get perspective, to share openly, to be vulnerable. They've also provided me with great counsel over time. I have not taken jobs because of them and their advice. I took this job, for many reasons, but one of them was they're telling me this is a no-brainer. Friends, there are many ways to define friends, right? But a guy that I knew in college once said that a friend is somebody who reminds you of who you are when you forget. And the truth is that all of us are going to forget who we are in a deeper sense. We're going to sometimes lose track of what really motivates us, what we're really passionate about. You might be coming, look, the tag for the Yale School of Management, leaders in business and society, that society part's really important. That was a big part of what made me excited about coming here. And I think the school has done a great job living up to that value. But you may have come here to say, hey, I really want to contribute to society more broadly, but then you find yourself pulled by something else, right? Maybe pulled by salary, maybe pulled by how fancy your job title is, maybe pulled by how fancy the company is that wants to hire you, whatever it might be. Those are moments where we can all get taken off track. And it happens to all of us. It's not a sign of someone who's weak or anything. It just happens, you're part of being human. But we need people in our life who can hold up that mirror, who can be that mirror and say, Corwin, I know you. We've known each other for years. I'm not hearing it in your voice. I feel like you're trying to justify that job to me. Like, this is not right. We got to pause here. You got to rethink this, right? We need people who can be honest like that with us. So all that just to say we need that as leaders, and that's not a sign of being weak. That's a sign of being strong and of having insight, right? In my experience, the strongest leaders are the ones who understand themselves the best. They know what they're good at, they know where they need help and support, and they're not shy or scared about seeking out that help and support. Those, in my mind, in my experience, have been the most effective leaders, whether it's in government or in the private sector.
Thank you so much for that. That was fantastic. I want to leave time for questions from the audience. There's a mic runner, or passer, a mic passer. So we have about 15 minutes of questions or so? Do I have a 10-ish, 15-ish, yeah. Yeah.
So, Dr. Murthy, thank you so much for coming, for your inspiring words, and for spending time with the Yale School of Management family yet again. You talked a bit about the third thing, which is, in your paraphrase what you said, not the easy thing in terms of influencing the world on things that are considered subjective or maybe a little out of the academic mainstream, and that's bringing people along. Can you talk a little more tactically about that? Because like you said, a lot of people want to do it. There's probably strategic inputs, but how do you do it? Like, what's the thing or the things that help you to bring people along in that way?
Well, and tell me your name.
Oh, sorry, Taman Osborne Roberts.
Turan, okay. Well, that's a really good question, Turan. And I think whatever walk of life you're in, right? Like, this is going to be critical to think about, whether you're running a small business, larger business, leading government. So I think a few things are important. I think one is, for people to listen to you, they need to trust you. That's really important. And Tom Friedman, New York Times journalist, and a sort of perennial source of fountain of knowledge. I remember he once said to me, he said, Vivek, people don't listen with their ears. They listen with their stomach. Their gut is what tells them what to do. And that is true. People may have varying levels of knowledge, but at a gut level, they make an assessment of you. Can they trust you or not? And that trust is often directly correlated to how honest and authentic you are. because people can sense inauthenticity, right? And you may not you may not be being inauthentic for a bad reason. You might think, gosh, I'm uncertain about this, but I got to appear really certain. I got to appear like really clear. But people can kind of sense that, So I think authenticity is critical to building trust. Trust is what gets people to listen to you. When they listen to you, then you have a chance to bring them on board. I think the second thing I would mention is that this is, again, where relationships matter, which is that relationships are the foundation of dialogue, right? When you know people, you're better able to listen to them, to give them the benefit of the doubt, even when you disagree, right? If you don't know somebody, they might say the first thing they say that you disagree with, you might say, yeah, I'm turning off, I'm not listening anymore. I think about, like, all of us probably have the crazy uncle or aunt, who we get together with around the holidays, who has like very different views from you. Maybe you completely disagree with them. Maybe you morally are completely opposed to half of their points of view, but you give them a hug when you see them. You would still show up if they were sick and in the hospital. You still care about them, right? And the reason you give them that benefit of the doubt is because you know them, right? And the truth is that all of us will have something that's objectionable, like in us. All of us have made mistakes in the past, right? But it's when we don't know each other that it becomes easier to judge one another, easier to not listen to other people. So in an organization, this is where I think creating those opportunities for people to understand one another, for them to understand you as a leader, to learn about not just what your vision is for the business, but what your motivations are as a human being, what your experience is as a person, that matters. Because in the workplace, people want to know who you are as a person, not just as a skill set. People also want to be known as human beings and not just as skill sets. It's not to say that everyone needs to know everyone's life secrets. I'm not saying that. But there's a humanness that can be missing, sometimes in the workplace. And when we bring that humanity back, we build relationships, we foster dialogue, and that's what really lets us talk to one another.
Thank you so much. There's another question here.
Thank you so much for being with us. My name is Becky. I'm in our MBA program in the healthcare focus. And my question for you is, I work in hospital operations, and burnout is very prevalent with hospital workers, healthcare workers in general. Can you comment about the connection with that burnout and loneliness and feeling understood, and how it is that we as leaders in this healthcare space can move this forward so that people are able to re-engage and provide the care that they want to provide for their communities, for our patients? Thank you.
Yeah, it's a really good question. And Becky, first of all, thank you for the work you do in a healthcare setting. It's such a tough environment right now, as you know, better than anyone. For those of you who may not be in the healthcare setting or have friends who are, the burnout rate among frontline health workers is just astronomical. 52% of nurses saying that they're planning to leave their clinical work, a quarter of doctors saying they're planning to leave their clinical work. That in and of itself constitutes a massive health access crisis, for our country, but not enough people are aware of that. In April of this past year, I issued a Surgeon General's advisory on this topic of health worker burnout, specifically to both to call the public's attention to this looming crisis that we have, but also to lay out clearly paths that we have to take as health systems, as academic institutions, as government, to help address the crisis. And there's not one simple solution, but I think that one of them, one of the many things we have to do is certainly look at the work itself that clinicians are doing. We load clinicians up with so much extra administrative work, right? We force them to function in electronic health record systems that are built for billing and not for patient care, right? We do things that make their work harder. And I remember rounding on a patient once with my medical team, and this elderly woman who, at the very end of our encounter, just reached out to me and said, "Hey, can I talk to you for a second? I have a question." I said, "Yeah." She said, "Can you just tell me, where do you guys go all day? You come here in the morning, you round on me, and then it's like you're gone. Are you guys playing golf? Like, what are you doing?" And it was like heartbreaking, but I was like, I didn't want to tell, like, yeah, we're like trying to deal with this clunky, like, EHR. We're trying to like get, prior auths, okayed by your insurance company. We're trying to get that rehab bed okayed, and like the reinsurance company's not okay. Like, we don't like want to walk her through all that, but that is like the administrative burden that they're dealing with. So our push to both private and public payers and to health systems has been that we have to dedupe the work that folks are doing in the hospital and relieve clinicians of a lot of this administrative burden. We also have to make mental health access resources and mental health care more accessible to healthcare workers. and which just isn't. A lot of lower wage health workers do not even have insurance. Those who do don't have the time and availability to actually get the help they need. But especially with virtual care, we can provide that much more easily than we had been before, and we've got to do that as well. But finally, I think that you know this because you're in the field, but there's old saying, right, in healthcare that if you don't measure it, it doesn't matter, right? So are we measuring burnout? Are we looking at how our frontline workers are doing? And some institutions are, most are not, right? And if we're not measuring it, we're not tracking it, there's no accountability. So this is a place also where we're working with accrediting organizations also to see how can we support institutions in tracking this. It shouldn't all be punitive, right? We should be helping institutions figure out how to track this, understand what's driving the burnout in their institution, and then help support them in addressing it. Finally, I'll just say this. Look, this is not all about reimbursement, right? This is a lot bigger than reimbursement. It's also about creating opportunities, environments where health workers feel heard and seen and understood, right? And a lot of health workers do not feel that right now in the environment they're in. They feel like people aren't understanding what they're going through. They don't necessarily have relationships with other folks in the workplace. And those really matter, especially in times of crisis, which is why you want to build them early. You want people to come to know each other because they can support each other better during a crisis. But I think that all of these things have to be part of what we think about. And our reimbursement has to be more rational also. We make health workers do things that we just do not reimburse health workers for, things that matter. I remember as a child seeing the letters that my parents would get. They ran a medical practice in Miami. The letters they would get from insurance companies chiding them for spending too much time with patients. They were spending time with those patients because they knew a patient would come in for a rash, but they were actually really anxious about their relationship with their spouse, and it was causing all kinds of concerns in their life, and they wanted to talk to them about that because they knew if they didn't help address that, that would manifest in a deeper crisis. But think about it, we pay people in healthcare for what they do to people, not for the time they spend with people. And what we're effectively, the message we're conveying to primary care doctors and nurses around the country is your time doesn't matter, right? We're devaluing the human service that they're providing. So it's a lot to do, but the reason we issue this advisory is because it's long past time that we start doing it, right? And no single health system can do that alone. No insurance company can do this alone. We have to do this collectively, and that's why we laid out that agenda.
So thank you so much. I know that we are running up against I'm being told that I have time for one more question. I'm going to exercise the canal privilege.
Okay.
And if you can roll with me for another 5-6 minutes or so.
Oh yeah.
You sure?
I'll roll with
Okay,
you.
good.
No worries.
So keep the questions tight, all right? Keep the questions tight.
If you even want to do this, can I just make one suggestion?
Combine.
Do you want to actually do 3 questions in a row? And then
Let's exactly. This is what we're gonna do. Let's do 1, 2, 3. I see a blue dress in the middle. I see a Yale in front in there, and there was somebody at the end who was over here. Was it you at the end? Yes. So those 3. Let's.
Okay. Hi, my name is Amy. The way you spoke about connection and disconnection and shame is really powerful. Can you share a little bit about your leadership and your colleagues' leadership on the mental health system and your vision for fixing some of the issues there? Thank you.
Thank you so much, Dr. Murthy. My name is Kamali. I'm in the School of Public Health, focusing on healthcare management. I wanted to ask you, knowing that public health is so much of a collective, and in your talk earlier, you mentioned that everyone can contribute, no matter if you're an expert or the layperson. Looking at grassroots organizations, and in your lens, looking at mental health through policy, institutional, and at the cultural level, where do grassroots organizations who focus on that mental and behavioral health work fall into those 3 sectors? And how do they integrate with health systems, and then trickling down the policy from there? How are we engaging with those organizations who are living and learning with the people on the ground at the local level?
The 3rd.
Hi, I'm Krupa. I'm an MBA student. My question is about what you think the connection between loneliness and trust as large into society would be, because you talked about how you need trust to bring people along and how loneliness can cause vigilance. So you also work on health misinformation, for example, and there's growing distrust in public health officials, growing distrust in our democratic processes, and how you see those connecting and how both issues could possibly be addressed.
These are great questions. I think these all actually go well together, because when it comes to the broader mental health agenda, what we need to do to fix mental health in our country, one of the things that, that we laid out when I issued the Surgeon General's Advisory in Youth Mental Health back in December was that there are 3 categories where we need to take strong action. Number one, there's a policy element here, where we have to institute policies that expand access to care and investment in prevention programs. Number 2, there's an institutional change piece here as well, which is we need to design our workplaces and our schools to support the mental health and well-being of workers and students. And number 3 is something we can't legislate, which is around changing culture, right? Which is we have to change how we think about mental health so that we think about it as part and parcel of overall health, so we don't see it as a source of shame or stigma, because we can have all the best services in the world, no one's going to use them if they feel ashamed to actually come forward. On the policy front, since we've issued our report, it's seen a tremendous response from around the country to that. We've actually been working closely with members of Congress, Republicans and Democrats, on mental health legislation that would do what I was mentioning earlier, expand access to care, invest in prevention programs. We've also been issuing, and we will be issuing, I should say, a product very soon on the workplace as well, and the workplace and mental health and well-being, because we want to work with employers, on how to strengthen and shore up the mental health of their workers. But that all goes part and parcel with the work in schools. You see, in schools, there are, in addition to social and emotional learning curricula, there are other programs that we know work to reduce the chance that young people will struggle with mental illness down the line. But we're just not investing or implementing those programs. A lot of schools would love to if they had the funds and the technical assistance to do so. But these are some of the changes we're working with directly, with associations and organizations. The cultural piece is the most challenging, but it's also the place where we have the most power as individuals, right? We don't need to be running an organization, you don't need to be in government shaping legislation to be able to lead efforts that shape and shift culture. And this is where, to Kamali's question, where the grassroots organizations come in as well, right? Because we saw very clearly in the COVID response that whether it's a vaccination effort or other public health response efforts, that these move at the speed of trust, right? It's when you have trust with organizations, with individuals, that you can open up, that you can share, that you can listen to what they're saying. And if they have a new way of thinking about something like mental health, you're more likely to listen if you know that organization, you know that person. We need, in particular, a very strong partnership now between not just government and grassroots organizations, but between health systems and grassroots organizations, because the work that needs to happen to not only help shift how we think about mental health, but get people resources where they are, that is work that grassroots organizations are intimately involved in and can be good at, right? Because they are where people are. They have trust, which is so essential in this process. Look, I'll just say this also, more broadly, we are, everywhere I go, in America, I hear about and sense just how deep a pain point mental health has become for people, whether it's their struggles with depression and anxiety, whether it's their deep struggle with loneliness and isolation, whether it's watching their children struggle with the effects of social media and not quite know what to do about that. People all across America know that something is not right, and it's more than about our physical health. And we also know that it's having manifestations outside. The vitriol, the anger that you sense in society, the division and disharmony that is so evident in our politics and our public dialogue, this is a symptom of a deeper pain and unrest that many people are feeling inside. Our calling, our charge, as people who are alive in this particular moment in time, and as citizens of this great planet, as people who are in positions to influence and change and shape our environment, our charge is to ask ourselves how we can address that deeper pain. How can we help people feel more connected, more seen, more understood? I've always believed that even though we may come from different cultures and traditions, and I know SOM in particular brings people from so many cultures and traditions and countries together, which is one of the great beauties of this institution. But one thing we all share as human beings is we all want to be seen and understood for who we are. We all want to know that we matter, and we all want to be loved. And so my ask of you, as you go out into the world and as you think about how you can contribute to everything that is unfolding, is actually to think about that last one in particular, about the fact that we all need to be loved, right? We all need that. And fundamentally, people's emotions exist on a scale between love and fear, right? Our love may manifest as generosity, as kindness, as empathy and warmth, but the fear we see all around us as insecurity, as anger, as jealousy and rage. And I'll confess that when we found out that we were pregnant with our first child 6 years ago, that after the initial joy sort of wore off, I found myself worried about what it would be like to bring a child into a world that was so deeply steeped in fear. None of us want that for ourselves, for our children, for our families. And it is up to us to change that. How we do that starts with us, with how we choose to lead our own lives, with how we treat people around us, with how we reach out to others who are in need, with how we choose to use our voice in the public square to talk about issues that matter, not just for us, but may matter to other people, even if they don't impact us, right? That is how we show people that we see them, that we understand them, that they matter, and that they are loved. And that charge to bring more love into the world, to live a life of love, to bring love to the lives of other people, that is a charge that we need everyone to take up in this moment. Businesses that are fueled by kindness and compassion are good places to work. They often do good things in the world. Schools and universities that are fueled by kindness and compassion and love, they provide a place for their students and faculty to thrive. And I've seen that in workplace after workplace after workplace. So that is what's called for right now. We all have the power to be healers because we all have the power to love, to contribute in positive ways to the lives of other people. So whatever you may do after SOM, I would ask you to just keep that in mind. I know you will have incredible opportunities that will give you the traditional benchmarks of success, that will allow you to make money, to assume positions of great power, and in many cases to be famous as well. But you and I and the dean all know people who are rich, powerful, and famous, and who are profoundly unhappy. Those three things, which we have often designed success around, those do not bring us happiness. What does bring us happiness are those human experiences with other people where we experience true connection, where we can see each other for who we really are, where we can be vulnerable, where we can give and receive love. And that is your greatest superpower, your ability to give and receive love freely. So I'm so grateful for this chance for us to talk, because if all of us can do just a little bit of that, if all of us can bring a little bit more love into the world and take a little bit more fear out of the world, we can listen more and judge less. We can reach out with an intention to help and to serve. We can make the world less full of fear, more full of love. We can do that for my kids. We can do that for your kids. We can ensure that the world that they grow up in is one that has a strong foundation, one where we come together to take on hard issues because we fundamentally care about each other and recognize that, as that old African proverb goes, that if we want to go fast, we go alone, but if we want to go far, we go together. Thank you so much.
Okay.